Over 50? Do this one exercise for poor leg circulation. If you're over 50 and your legs feel heavy, tight, cold, numb, or tired for no clear reason, this message is for you. You might notice swelling around your ankles by evening. You might feel stiffness when you stand up after sitting. Or maybe your feet just don't feel as warm or alive as they used to. Most people think this is just aging. But the truth is, in many cases, it's poor leg circulation, and it's not something you should ignore. What's even more surprising is that improving circulation doesn't always require multiple workouts, gym machines, or long walks that hurt your knees or back. In fact, today I want to talk about one simple exercise that many people over 50 overlook, even though it directly targets circulation in the legs better than most routines. And the best part? You can do it safely, at home, and without stressing your joints. Before we get into the exercise itself, let's quickly talk about why leg circulation becomes a problem after 50, because once you understand this, the exercise will make perfect sense. As we age, blood flow naturally slows down. The heart still pumps, but the veins in the legs have to work harder to push blood upward against gravity. Over time, the muscles that help pump blood, especially in the calves, become weaker or less active. This is important, so listen closely. Your calf muscles are often called your second heart. Every time they contract, they squeeze the veins in your legs and push blood back toward your heart. When they don't move enough, blood can pool in the lower legs. That's when symptoms begin. Swelling, heaviness, aching, cramping, cold feet, tingling or numbness. Many people try to fix this with medication or compression socks alone. Those can help, but they don't address the root cause, inactive muscle pumping. Now here's where the mistake happens. Most exercise advice tells people over 50 to walk more or do leg workouts that involve squats or lunges. But if you have joint pain, balance issues, or stiffness, those exercises can feel intimidating or even painful. That's why so many people give up. But what if I told you there's one gentle movement that directly activates the calf pump, improves blood flow, and can be done sitting or standing, even if you haven't exercised in years? That exercise is called ankle pumping. It sounds simple, almost too simple, but don't underestimate it. Ankle pumping is one of the most effective movements for improving circulation in the lower legs, especially for people over 50. Let me explain why this works so well. Every time you point your toes forward and then pull them back toward your shins, your calf muscles contract and relax. This repeated action acts like a natural pump, pushing blood upward through the veins. Unlike high-impact exercises, ankle pumping doesn't stress the knees, doesn't compress the spine, doesn't require balance, doesn't cause breathlessness. Yet it directly targets circulation where the problem actually starts. Now let's talk about how to do it properly, because how you do it matters just as much as doing it. First, get into a comfortable position. You can sit in a chair with your feet flat on the floor, or lie down with your legs extended. If standing feels safe and comfortable for you, you can also do it while holding onto something sturdy. Relax your shoulders. Breathe normally. There's no rushing here. Now slowly point your toes forward, away from your body. Feel your calves gently tighten. Hold that position for about 1 second. Then slowly pull your toes back toward you, as if you're trying to show the bottoms of your feet. You should feel the front of your lower legs engage. That's 1 repetition. The key is slow, controlled movement, not fast bouncing. When people rush this exercise, they miss its full benefit. Aim for about 20 to 30 repetitions, then rest for a moment. You can do one leg at a time or both together, depending on what feels comfortable. As you do this, pay attention to the sensations in your legs. Many people feel warmth, light tingling, or a sense of awakening in their feet and calves. That's a good sign. It means blood is moving. Now here's something most people don't realize. Doing ankle pumping once is helpful. But doing it consistently throughout the day is where the real improvement happens. You don't need a single long session. You can do a few minutes in the morning, a few minutes after sitting for a long time, a few minutes in the evening. Especially if you sit a lot during the day, this exercise can make a noticeable difference. Let's talk about common mistakes, because avoiding these will protect your legs and help you get better results. The first mistake is holding your breath. Breathing helps circulation too, so keep it natural and relaxed. The second mistake is forcing the movement. If your ankles feel stiff, don't push into pain. Small, gentle movements still work. The third mistake is inconsistency. Doing this once a week won't change much. Doing it daily, even for a few minutes, absolutely can. Now you might be wondering, can one simple exercise really help poor circulation? And that's a fair question. The answer is yes, when it targets the right muscles. Medical professionals often recommend ankle pumping for people recovering from surgery, long periods of bed rest, or long flights because it's proven to improve venous blood flow. For people over 50, it's especially valuable because it reawakens inactive muscles, reduces pooling of blood in the lower legs, helps decrease swelling over time, supports overall leg comfort. Some people even notice their legs feel lighter within days. But I want to be very clear about something important. This exercise supports circulation, but it mobility. Replace medical care. If you have severe pain, sudden swelling, or diagnosed vascular conditions, you should always follow your doctor's advice. That said, for everyday circulation issues related to aging and inactivity, this movement is one of the safest and most effective tools you can use. In the next part, I'll explain how to combine ankle pumping with breathing for even better circulation, when the best time of day is to do it, how long it takes to notice real improvement, and how to modify it if you have stiffness, arthritis, or limited mobility. Now let's go a little deeper, because understanding when and how you do this exercise can make a big difference in how effective it becomes. Most people think exercise has to be done all at once, like a workout session. But circulation doesn't work that way. Blood flow responds best to frequent gentle movement, especially in the legs. That's why ankle pumping works so well when you spread it throughout your day instead of treating it like a single task. One of the best times to do this exercise is right after waking up. During sleep, circulation naturally slows, especially if you don't move much overnight. That's why many people feel stiffness, heaviness, or numbness in their legs first thing in the morning. Doing ankle pumps before you even stand up helps wake up your circulation gently. It prepares your legs for standing and walking, reducing that shaky or stiff feeling. Another powerful time to do this exercise is after sitting for long periods. If you sit watching TV, using your phone, driving, or working at a desk, blood tends to pool in the lower legs. You may not notice it right away, but over time it contributes to swelling, discomfort, and fatigue. A few minutes of ankle pumping after sitting helps reverse that pooling and reminds your muscles to do their job. Evening is another important time. By the end of the day, gravity has been pulling blood downward for hours. That's why ankles often look puffier in the evening, and shoes may feel tighter. Doing ankle pumping in the evening can help move fluid back upward and may even improve how your legs feel when you go to bed. Now let's talk about breathing, because this is where many people miss an opportunity to improve circulation even more. Breathing isn't just about oxygen. It also helps move blood and lymph fluid through the body. When you inhale deeply, pressure changes in your chest help pull blood back toward the heart. When you exhale, the body relaxes and resets. If you combine ankle pumping with slow, relaxed breathing, you create a double pumping effect, one from your calves and one from your breath. You don't need complicated breathing techniques. As you point your toes forward, breathe in gently through your nose. As you pull your toes back, breathe out slowly through your mouth. No forcing. No holding your breath. Just calm, steady breathing. This small addition can make the exercise feel more soothing and effective, especially if you tend to feel tense or stressed. Now let's talk about what happens inside your body when you do this exercise regularly. Within the first few days, many people notice subtle changes. Their legs may feel warmer. Their feet may feel more responsive. That heavy, dull sensation starts to fade. Over a couple of weeks, swelling may begin to decrease. Not dramatically overnight, but gradually and consistently. What's happening is your veins are getting help from your muscles again. Blood isn't just sitting in the lower legs anymore, it's moving. Over time, this can reduce strain on the veins and make daily movement more comfortable. Some people also notice fewer nighttime leg cramps. Poor circulation and muscle fatigue often contribute to cramping, especially at night. By improving blood flow during the day, you support healthier muscles when you're resting. Now let's address stiffness and arthritis, because this is a big concern for people over 50. If your ankles feel stiff or painful, you may be tempted to avoid movement altogether. But avoiding movement often makes stiffness worse. The key is gentle, pain-free range of motion. If pointing and flexing your foot fully feels uncomfortable, reduce the range. Even small movements are beneficial. Imagine you're just rocking your foot slightly forward and backward. That's enough to stimulate circulation. As your joints warm up and become more flexible over time, you may find the movement becomes easier and smoother. This exercise also helps lubricate the ankle joints. Movement helps synovial fluid circulate, which supports joint health. Now let's talk about consistency, because this matters more than intensity. You don't need to count representatives perfectly. You don't need to push hard. What matters is doing this every day. Think of ankle pumping like brushing your teeth. You don't do it once a week and expect results. You do it daily, and the benefits build quietly over time. Even doing it for 2 to 3 minutes at a time, multiple times a day, can be more effective than one long session. Now I want to talk about something emotional and very real. Many people over 50 feel frustrated with their bodies. They feel betrayed by aches, stiffness, and limitations. That frustration can turn into avoidance, avoiding movement because it reminds them of what they can't do anymore. But this exercise is different. It's gentle. It's achievable. It doesn't demand perfection or athletic ability. And because it works with your body instead of against it, it often restores confidence. When you feel your legs responding again, even in small ways, it changes how you feel about movement as a whole. That mental shift is powerful. Now let's clear up a common misunderstanding. Some people think circulation problems only affect people who are overweight or inactive. But circulation issues can happen to anyone over 50, including people who walk regularly. Why? Because walking doesn't always fully activate the ankle pump, especially if your stride is short or stiff. Ankle pumping isolates and exaggerates the exact movement that pushes blood upward. That's why it's so effective as a focused exercise. You can walk and still benefit from this movement. In fact, combining both is ideal. Now let's talk about warning signs you should pay attention to. If you notice sudden, one-sided swelling, sharp pain, redness, or warmth in one leg, that's not something to ignore. Those symptoms require medical attention. This exercise is meant to support everyday circulation, not treat emergencies. Always listen to your body. In the next part, I'll explain how long it realistically takes to see lasting improvements, how to adjust this exercise if you have balance issues, how this one movement can improve more than just your legs, and how to make it part of your daily routine without effort. Now let's talk about expectations, because unrealistic expectations are one of the biggest reasons people stop doing helpful things too early. This exercise is not a quick fix in the dramatic sense. It doesn't promise overnight transformation or instant relief for every person. What it offers is something more reliable, gradual, steady improvement. Most people start noticing small changes within the first few days to a week. That might be less tightness in the calves, a bit less swelling around the ankles, or simply feeling more comfortable standing up after sitting. These small signs matter. They tell you circulation is improving. For more noticeable changes, such as consistently reduced swelling or improved leg comfort throughout the day, it usually takes a few weeks of regular practice. That timeline is normal. Your blood vessels and muscles didn't become less efficient overnight, and they won't recover overnight either. But they do respond to consistent, gentle stimulation. Now let's talk about balance issues, because many people over 50 worry about falling or feeling unsteady. The good news is that ankle pumping can be done without standing at all. If balance is a concern, sitting or lying down is perfectly fine. In fact, many physical therapists recommend starting this exercise in a seated position. Over time, improving ankle mobility and circulation can actually support better balance. Your ankles play a big role in stability, and waking them up helps your body respond more quickly when you shift position. Some people choose to do ankle pumping while standing and holding onto a counter or chair. That's fine too, as long as you feel safe. There's no better version, only the version that works for you. Now here's something many people don't expect. Improving leg circulation can affect more than just your legs. When blood flows more efficiently from the lower body back to the heart, it reduces overall strain on the cardiovascular system. This can help you feel less fatigued throughout the day. Some people report feeling more energized, even though the exercise itself is gentle. Better circulation can also support skin health in the legs and feet. Dryness, discoloration, or that dull look some people notice can be linked to reduced blood flow. While this exercise isn't a cosmetic treatment, improved circulation often shows itself in subtle ways. Now let's talk about habits, because habits are what make this work long-term. The easiest way to make ankle pumping part of your life is to attach it to things you already do. For example, do it while watching TV. Do it while reading. Do it while sitting on the edge of the bed in the morning. Do it while waiting for something, like water to boil or a program to load. When you stop treating it like exercise and start treating it like normal movement, it becomes effortless. You don't need motivation. You just do it. Now I want to address something that often goes unspoken. Many people over 50 worry that their circulation problems mean something is wrong with them. They feel embarrassed by swelling or discomfort. But circulation changes are incredibly common with age. They're not a personal failure. What matters is how you respond. Choosing gentle, consistent movement is one of the most respectful things you can do for your body. Now let's talk about footwear, because it can affect circulation more than people realize. Tight shoes, rigid soles, and high heels limit ankle movement. When the ankle doesn't move freely, the calf pump doesn't work as well. If possible, choose shoes that allow your ankle to move naturally. Even at home, spending some time barefoot or in flexible footwear can help. This doesn't mean you need to change everything overnight. Just be aware of how your shoes affect your movement. Now let's talk about hydration. Blood flow depends on fluid balance. If you're dehydrated, blood becomes thicker and harder to move. Drinking enough water throughout the day supports circulation naturally. You don't need extreme amounts. Just consistent hydration. Pairing ankle pumping with proper hydration creates a supportive environment for your circulatory system. Now let's address a common concern. What if I forget to do it? That's normal. Missing a day doesn't undo your progress. Just return to it the next day. This is not an all-or-nothing practice. Every time you do it, you help your legs. Now let's talk about mental resistance. Sometimes people avoid gentle exercises because they feel too easy to matter. They think real change requires discomfort or intensity. But circulation responds to rhythm and repetition, not strain. Think of your legs like a river. You don't force water to flow by pushing harder, you remove obstacles and keep it moving. This exercise keeps things moving. Now let's talk about nighttime comfort. Many people over 50 complain that their legs feel restless or uncomfortable at night. Poor circulation during the day can contribute to this. Doing ankle pumping in the evening helps calm the legs and may improve nighttime comfort. Some people even do a few gentle pumps while lying in bed before sleep. Now here's something important. This exercise is not about perfection. It's about kindness to your body. There's no competition. No finish line. Just consistent support. In the next part, I'll cover how long you should continue this exercise, whether you can overdo it, how to know it's working, and why this one movement often leads people to move more naturally again. Now let's talk about how long you should continue this exercise, because this is where people often get confused. This is not a program you do for a few weeks and then stop forever. It's more like maintenance. Circulation depends on movement, and as long as gravity exists and we spend time sitting, the legs need help. That doesn't mean ankle pumping has to feel like a burden. It simply becomes part of how you move. You might do it more often in the beginning when you're trying to improve symptoms. Later, you may naturally do it less frequently, but still regularly. Think of it as something you keep in your toolbox for life. Now let's talk about overdoing it, because people sometimes worry about that. With ankle pumping, it's very hard to overdo it. This is a low-load, low-impact movement. As long as you're not forcing the range of motion or pushing through pain, your body can tolerate frequent repetition. If your legs feel pleasantly tired or warm afterward, that's normal. If you feel pain or sharp discomfort, that's a sign to reduce the intensity or range. Listen to your body, not a number. Now let's talk about how to know if it's really working. The signs are often subtle at first. You might notice your legs feel lighter. Your shoes feel less tight by evening. You stand up more easily after sitting. Your feet feel warmer. You have fewer cramps or aches. These changes often appear gradually. It's helpful to pay attention, not obsessively, but with awareness. Some people keep a simple mental note of how their legs feel at the end of the day. Over time, they notice improvement. Now let's talk about something interesting. Many people who start with ankle pumping begin to move more naturally in general. They start shifting their feet more when sitting. They stretch their ankles without thinking about it. This is a good thing. It means your body is relearning movement patterns that support circulation. The more naturally you move, the less you have to exercise intentionally. Now let's talk about why this one exercise is often more effective than complex routines. Complex routines can be overwhelming. They require time, space, motivation, and sometimes equipment. When life gets busy or energy is low, those routines are the first to be dropped. Ankle pumping survives real life. You can do it when you're tired. You can do it when you're distracted. You can do it without planning. That's why it works long term. Now let's address a common fear. Some people worry that focusing on circulation means something serious is wrong with their heart or blood vessels. In most cases, everyday leg circulation issues after 50 are related to muscle inactivity and gravity, not serious disease. This exercise supports your body's natural systems. Of course, if you've been diagnosed with specific vascular conditions, you should always follow medical guidance. This movement complements care, it doesn't replace it. Now let's talk about patience. Patience doesn't mean doing nothing. It means doing the right thing consistently without rushing the outcome. Your body responds best when it feels safe, not pressured. Gentle repetition builds trust between you and your body. Now let's talk about mindset. Instead of thinking, I have poor circulation, try thinking, I'm supporting my circulation. That shift matters. It turns the focus from problem to action. Now let's talk about age. Being over 50 does not mean decline is inevitable. It means your body responds differently. It needs more consistency and less force. Ankle pumping respects that. It doesn't fight your body, it works with it. Now let's talk about long-term benefits. Over months and years, maintaining good circulation supports leg comfort, joint health, muscle endurance, daily mobility. These things add up. Comfortable legs make it easier to stay active. Staying active supports overall health. It's a chain reaction. Now let's address motivation one last time. You don't need motivation to do this exercise. You only need a reminder. When you feel stiffness, pump your ankles. When you feel heaviness, pump your ankles. When you're sitting, pump your ankles. Your body will start to associate the movement with relief. That's powerful. In the next part, I'll talk about what happens if you stop doing it, how to restart if you've been inconsistent, why this exercise is often recommended by medical professionals, and how to make peace with gentle movement as you age.